Tonight, the inquiry into the NHS blood scandal hears from former pupils at a boarding school for children with disabilities, where dozens died. Harrowing testimony from those at the school in Hampshire given contaminated blood products in the 70s and 80s.
He said, we don't know a lot about it, and the outlook's not good. We can't guarantee that you'd be sort of alive in a couple of years. And that was it, really.
Not many did survive, but those who have say it has scarred them forever. Good evening. Former pupils from a boarding school for children with disabilities have been telling a public inquiry how dozens of their fellow students died after being given contaminated blood products. The Infected Blood Inquiry was set up to examine how thousands of people contracted HIV and hepatitis in the 1970s and 80s in what's been called the worst treatment disaster in the history of the NHS. The children were treated for haemophilia at an NHS centre based at the school in Hampshire. They were given blood products infected with HIV, and many were left to tell their parents they weren't expected to survive more than a year or two. More than 120 children at Treloar College were treated on site for haemophilia, a serious bleeding disorder, between 1974 and 1987. At least 72 children later died, some from the same family, after being given a new drug that was contaminated with HIV and viral hepatitis. Across the UK, it's estimated more than 30,000 people were infected by contaminated blood and blood products, and at least 3,000 people died as a result. Our health editor, Hugh Pym, reports.
What will they do with it?
They are among the survivors, but they've lost at least 72 former schoolmates because of treatment with tainted blood products. Today, some living with HIV and hepatitis C gathered wearing their campaign ties at the inquiry, with a week of evidence ahead on what happened at Treloar College in Hampshire. Gary joined the school at the age of 10 and soon was being treated for his haemophilia with a blood-clotting agent known as factor VIII. Later, aged 18, he and some others were called in by a doctor and told they'd been infected with HIV.
He said, we don't know a lot about it, and the outlook's not good. We can't guarantee that you'd be sort of alive in a couple of years. And that was it, really.
Treloar College, shown in this 1970s film, was a boarding school with specialist NHS haemophilia treatment provided at the site. A statement from the school said it was completely supportive of the campaign for justice by former pupils after they were harmed at the NHS clinic. Of more than 100 pupils since the mid-1970s, only about a quarter are still alive.
I have guilt, still being here. It's stigma, losing 72 friends, school friends, who you've known since you were that high. So that's been difficult. I think I'm an angry old man now.
At the inquiry, bottles with messages for lost loved ones are on display. Victims and families have long argued there was an official cover-up. Contaminated blood products were imported, some made from plasma from donors who were paid, including prisoners. The inquiry will soon be hearing from some of those who were senior health officials and other key decision makers back in the late 1970s and early 1980s. Kenneth Clarke, who was a health minister for some of that time, will also give evidence. But this week the focus is very much on the heart-rending Treloar saga.
Our parents and us were blissfully unaware of the risks that were being taken with our young lives and of the cruel tragedy that was about to unfold. I would like to thank my family for their support and love through the years. And finally, the comradeship and strength of the remaining Treloar survivors. Without them, I would not have been able to do this today.
Hugh Pym, BBC News.